Being prepared for disaster is critical to protecting Yolo County residents in an emergency. Development of detailed response plans is only part of being prepared. After all, it doesn't do any good if plans just sit on a shelf. It's also essential to practice those plans by participating in emergency drills and exercises. On June 25, 2010, Operation EVAC was held to exercise plans and procedures for response to a simulated structure fire and evacuation incident at Woodland Memorial Hospital. Exercise participants came from a variety of organizations throughout Yolo County. Objectives were to train responders and hospital personnel in hospital evacuation processes, test and evaluate disaster management and communications procedures between all agencies, and evaluate evacuation and tracking procedures for hospital patients who would need to be safely relocated along with their medical records in an emergency. The 3-hour exercise began at 9 a.m. with a simulated fire on the 3rd floor of the Woodland Memorial Hospital. While the fire was simulated, all of the audible alarms and response of the staff involved were real.
We have a fire just right outside the break room.
Nurses heard the fire alarm and saw white, billowing smoke coming from the staff break room on the 3rd floor, in an area where the coffee pot, microwave, and highly flammable in-wall oxygen lines are located. As fire officials are notified, the charge nurse orders an immediate evacuation of the 3rd floor and initiates the hospital's fire response plan.
You've got flames coming out of this room. Heavy smoke.
The fire gets worse as the 3rd floor fills with smoke and drywall combusts at an expanded rate. Fire and emergency response crews rush to the scene. Over the next several hours, the tension heightens as responders to this realistic scenario follow their protocols to save lives and fight the flames. Patients are quickly but carefully moved to safety and then transferred to nearby facilities. Fire crews, hoses, and equipment add to the commotion in the hallways as firefighters locate hot spots and fight the flames in reduced visibility. Outside, arriving ambulance crews transport patients and stand by to treat injuries. Fire equipment stages on the property, and police are in place to control traffic and keep the public at a safe distance. Communications staff prepares news releases to keep the media and the public current on the situation. As the exercise continues throughout the morning, staff from responding agencies work together to communicate new developments that are injected into the drill by exercise controllers. Evaluators are also on hand to observe and take detailed notes on any problem areas that they might see, as well as document positive examples of good teamwork that add to the efficiency and safety of the response. In all, more than 80 persons representing 16 organizations took part in Operation EVAC. Following the exercise, participants met together in so-called hot wash evaluations, designed to immediately capture their impressions of what worked well in the exercise and what needed improvement. Emergency exercises like this one may not be able to simulate or predict every single thing that may occur in an actual event. However, they are an excellent method of practicing and fine-tuning response plans, as well as allowing people from different agencies who will be working together in a disaster to get to know each other and everyone's responsibilities. Then, when the inevitable emergency does occur, Yolo County responders will be well-trained, familiar with disaster plans, and prepared to initiate one of the most effective responses possible to protect the citizens of our region.